My name is Raymond, and today I will be responding to the claim that the legal drinking age for the United States should be lowered to 18 in order to decrease the illegal alcohol consumption for minors. So my opponent's secondary claims were that lowering MLD would create regulations, MLD is ineffective since most teens consume alcohol regardless, and 18 is the age of adulthood in the US. So in the first claim, they state, by prohibiting this younger age from drinking in public places with regulations, safety precautions, that it increases the chance of unsafe behavior and binge drinking. When in fact data shows that a higher MLD age shows decrease in binge drinking. Researchers from Washington University School of Medicine analyzed data gathered between 1979 and 2006 by the National Survey on Drug Use and Health. The research found reduction in binge drinking, especially among males aged 20 and younger. In males ages 15 to 17, binge drinking rates declined nearly 50% between 1979 and 2006. During the same period, rates declined more than 20% in males aged 18 to 20 and 10% in males aged 21 to 23. They also added in that there are fewer drunk driving accidents and fatalities in countries with MLDA of 18. Although countries with lower MLDA than US may have lower drunk driving accidents and fatalities, the correlation is not helpful to the claim for the US and does not give reasoning to assume that there is a strong correlation between the MLDA and a country's overall drunk driving accidents. In 2014, the Journal of Studies on Alcohol and Drugs found that after the drinking age was raised nationally in the US to 21 in the 1980s, the number of fatally injured drivers with a positive blood alcohol concentration decreased by 15% among ages 18 to 20, compared with a 39% decrease for those 21 to 24 and 9% for those aged 25 and above. Their second claim was that MLD is ineffective since most teens consume alcohol regardless. They stated that lowering the MLD would diminish the thrill of breaking the law. The reasoning they used was a study done by Forbes magazine. According to the study, most teens consume alcohol solely for the thrill of breaking the law and the fun that comes with it. And with this, it is much easier to access other illegal substances. The study used for their reasoning is very vague with little statistics and uses claims such as most teens. And the source of Forbes magazine does not seem as a reliable source for information on teen incentives for drinking. In addition, a peer-reviewed study from the Journal of Studies of Alcohol and Drugs found that a younger person begins to drink alcohol, the more likely that they will use other illicit drugs. Lowering MLD 21 would increase the number of teens who drink and therefore the number of teens who use other drugs. The third claim was that 18 is the age of adulthood in the US. Teens who are 18 do not get that much freedom. They use an example of nicotine, as nicotine is illegal to purchase at 18, while the consumption at 18 is legal. The example used is not really related to underage drinking, as drinking is known to be associated with driving accidents, domestic violence, and sexual harassment. And the fact that one turning 18 does not mean one can be deemed responsible with alcohol. It's important to note a minimum drinking age of 21 does not prevent all drinking among teenagers and 20-year-olds, but it does help decrease underage drinking. And that is why the MLDA is a positive policy in the US. Thank you.
Right, the structural stuff is fine. On the first point, you basically argue a big counterclaim suggesting that the higher the MLDA, the lower rates of binge drinking and other assorted problems come along with that. There's not really any discussion of what the advocate's information was on those particular points. So when I'm contrasting your information to theirs, it's a little bit hard to make the comparison. But you do have a good piece, a couple of good pieces of statistical information about how binge drinking decreased over the period of time that the MLDA was going up. I thought that was pretty effective. The notion that there is they had a piece of evidence that said there are fewer drunk driving accidents with countries that had higher or lower MLD laws, and you say it's not really applicable, it's not helpful, and I'm wondering why. You don't really explain what the reason is. There might be something different about those countries and the rules under which they operate that would explain that. For example, licensing requirements, or whether or not people have cars available to them even if they are able to drink. If they don't have a car available to them, I could see why they would have lower death rates in that particular situation. I'm not sure what the ownership rate of cars is among people between the ages of 18 and 21 in countries where the drinking age is 18 years old. That would probably be the most useful piece of information. The data that you have that shows that the MLDA declined, that the drunk driving rate among those in those age groups declined as a result of the MLDA, that was pretty effective. You don't give us a final count of numbers of lives that are saved, but you do have some percentages that suggested it declined, and that's fine. On the second point, the notion that this is like a forbidden fruit, and that's why the teens want to take advantage of this. I think you've got an okay argument suggesting that, like I said, the risk is diminishes when the age of drinking is increased. That's okay. I think there are probably some other arguments that could be made here. For instance, that you are simply lowering the age at which people are likely to have onset drinking. If drinking is legal at 18, then it's the 15-year-olds who are going to want to challenge the law and that sort of thing. I think there's probably a reasonable inference to be made there. On the third point, you kind of dismiss the nicotine comparison. I think the nicotine comparison might work, especially in a place like California, where the age for purchasing nicotine has gone up from 18 to 21. It's also in Hawaii and a couple of other states where they've done that. There are lots of comparisons of rights that people have that they don't get until they're 21. The notion that 18 is the standard is based primarily on the voting rights change that occurred in the early 1970s. Prior to that, 21 was the age of majority, and it continues to be the age of majority for a variety of other things. I think that would be the more useful comparison for you. Although that whole point is really not relevant because, and by the way, the whole proposition that you've got here is a claim of policy, and the third point is a claim of value supporting that claim of policy. The first and the second points are factual issues, so your responses to them seem like a little bit more appropriate. Okay, thank you.